Prisoners by de facto are going to be the most disadvantaged and vulnerable people in our society. And from my point of view, if I've got something that I want to help someone else with knowledge, experience, like why not do it with where the most gains are going to be? And that's with someone who potentially has an extremely low baseline in terms of engagement with healthcare systems already. So from a personal point of view, you're going to get maximal benefit, if you like, in terms of what I can give. We're asking you to be a really safe pair of hands who enjoys clinical medicine, who enjoys that kind of clinical curiosity. Patients that we encounter in prison are potentially not engaged well with healthcare before, and that means that we are exposed then to all manner of presentations which you might not have experienced in normal general practice. My own personal knowledge has increased massively because of the exposure to sort of so much of medicine. I now feel like I'm actually practicing medicine as I was trained to do right back at the beginning of training. This is all of the medical textbooks in one place, essentially, rather than what I found in general practice, where it was a very, very narrow part of medicine. What we do at Practice Plus Group is we work as a team. So at every site there is obviously a GP like myself, but then there's a whole host of other professions. Obviously there's a whole team of nursing staff, but as we will work with mental health colleagues, psychiatrists, substance misuse colleagues. And so we're really asking the GP to maybe step outside of a comfort zone of being in your own room on your chair to potentially looking more like working in a hospital where you are feeding into the joined up working so that we can get the most out of or the best care for our patients.